Kelly, and I'm going to be your nurse for today. How are you doing?
Hi.
Can you please tell me your name and date of birth?
Natalie Dean, February 6, 1992.
Okay, thanks, Natalie. So can you start off by telling me what brings you in here today? What's been going on?
Yeah, well, I just haven't been feeling good at all lately.
Dear, tell her what's been wrong. Don't be shy.
Okay, Mom, relax. Well, I've just been feeling really short of breath lately when I've been playing soccer, and I never feel short of breath. Also, I feel like my heart has just been beating really fast lately, even when I'm not playing soccer. And also, I've been noticing that I've been bruising a lot lately, all over, and I never usually bruise. And I've been getting these random nosebleeds at random times.
How long have you been noticing this for? Has it been a few days, a few weeks?
Oh my, it has been going on for a few weeks now, and I'm so concerned about her. When she gets those nosebleeds, I just worry that she is going to get blood all over my new white carpet.
Have you noticed anything else new? Like, does it take a while for any of your wounds to heal? Have you had any consistent temperatures that you just can't get down?
Well, actually, yeah. I've noticed that I've been feeling really sick lately. So about a week ago, I started taking my temperature every day. And I've noticed that my temperature is about 100 degrees Fahrenheit every day. And I'm pretty sure that that's high.
Well, what we're going to do is we're going to draw some blood. So we're going to have the lab come up and we're going to get some blood drawn, send it back to the lab to see if we can find anything, what's going on. And as soon as we get the results back, we'll be sure to call you and set up an appointment. It should be about a day, just so you know, and we'll get that all set up.
Yes, good. Fix my little dear.
Alright, Dr. Lutz, the results came back for Natalie Dean. Here, if you want to take a look at them.
Okay, let me see here.
Come in.
Hi, Natalie. My name is Dr. Lutz.
Hi, her mom.
Nice to meet you.
Nice to meet you.
So we just got back your test results from the blood work that you had drawn yesterday. And let's just take a look here. So it looks like your white blood cell count was low. Your hemoglobin and hematocrit were also low, as well as your platelet count. The serum iron and the total iron binding were high. The EPO was also high, and the reticulocyte count was low.
What does this even mean?
Yeah, what can we do about it?
Well, the blood studies that we got back are inconclusive. So we're going to perform a bone marrow aspiration, and I'll write the order for that. We can get that through and maybe find out what's going on.
Okay.
Thank you.
Hi, I'm Erin. I'm your nurse today. Are you Natalie? Hi, nice to meet you.
Hi, I'm her mom.
Oh, nice to meet you too. So we've gotten the bone marrow aspiration results back. They showed that your bone marrow is hypocellular with decreased number of mature cells and an increased fat content. The doctor has concluded that your diagnosis is...
Wow, I don't even know what that is. How could have I gotten that? Wow.
How did she get that?
Well, it's actually a very rare disease. It only occurs in about 2 in 1 million people a year. But it can be caused by several different things. It can be congenital, meaning that you're born with these defects for the disease, or it can result from exposure to drugs, radiation, infection, or other chemical agents.
Wow, I'm so shocked, and I have no idea how I could have gotten this. I mean, what could have I exposed myself to?
Well, the thing about this disease, Natalie, is we'll never really know. It's idiopathic, meaning that we can't trace it back to anything. But the good news is, now that we've diagnosed it, we'll be able to treat it.
What are the treatment options for her then?
Okay, well, since we caught this so early, you have a very good prognosis for the future. The primary option that Dr. Lutz has recommended at this point is taking immunosuppressive drug therapy, and this has been shown to significantly improve the outcomes of patients. With this, you'll be taking an ATG serum that'll help fight, or that has antibodies that will help fight against the T cells that are harming your body. Once you start taking this, you'll be at an increased risk for infection related to this immunosuppressive therapy. So you'll have to be very cautious, make sure you're handling your food okay and washing your hands, and we can talk about other things later that you can also improve on. There's also a possibility of needs for a blood transfusion due to your low hemoglobin and hematocrit that Dr. Lutz talked about, and that's due to your frequent nosebleeds. If we don't see any improvement after this, though, there's also a need for a bone marrow transplant in the future. How are you feeling about all this?
Medicine, a bone marrow transplant? Really? Am I ever going to be able to play soccer again?
It must be tough to have to deal with this, and maybe we can talk more about the situation and discuss options to manage your fatigue related to inadequate oxygenation of the blood, as evidenced by your verbalization of overwhelming lack of energy in response to soccer. We'll have to monitor your cardiorespiratory activity in response to your activity to evaluate for any dysrhythmias or dyspnea. We'll also have to make a plan to organize your daily activities in order to provide rest periods to assist in conserving your energy. So for now, it would be best if you would stop playing soccer until we get things figured out and we can discuss in the future about reincorporating this. We'll work together to manage your symptoms and create a plan that fits together in your lifestyle. How does that sound?
Let's get it done so my baby can heal and get better.
Yeah, let's do it.